Okay. We just wanted to update you as the local county board of health as well, some of the measures that are being put into place. Right now we are mitigating the spread of the coronavirus. We have been meeting with all of our ESF 8 partners, which is health and medical, hospital, clinic, long-term care, county health, EMS. As you all know, the president did declare a national emergency last week. This Kansas governor also has declared a state of emergency for the state of Kansas. That is extended until January of 2021. The county, Cheyenne County, is currently not under a state of emergency. That may change in the future if need be. And our EOC is basically at a monitoring level right now. We're monitoring all the information coming down. Due to these emergency declarations at the federal and state level, it has lifted waivers and has changed policies and procedures and how we do things, and so we're working through all that at a local level as well. You will start to see first responders wearing PPE. That's their personal protective equipment. They'll be wearing gowns and masks and gloves. That's not to alarm anyone or mean that we have this. They are taking precautions so we protect our staff. We're also going to be limiting the exposures, meaning law enforcement may not go to routine EMS calls and that sort of thing. Because the whole point of this is to try to limit our exposure as much as possible and to help mitigate the spread. We have Nicole from Cheyenne County Hospital here, Erica with Cheyenne County Clinic, Tabitha Ketzner is the County Health Administrator, and Eric is with Dispatch, which is part of this as well, because when you call 911, you're going to be getting asked questions to help direct EMS in their response, and we have Jill here representing EMS. So I'll kind of let them briefly all speak on what their agencies are doing. So.
Okay. Nicole?
How are you guys today?
Well, thank you.
Good. So as far as the hospital side and how we're taking care of things, if a patient were to call in, the nurses are equipped with a screening tool on how to ask the patient the appropriate questions to figure out if this is a possible person under investigation. A PUI is what we refer to them as. Right now there is currently no treatment for the coronavirus, and so everything is strictly symptom management. So our nurses are very educated and great with triaging as far as how to treat symptoms and everything like that. So they are just going to do their jobs as they previously have been in that aspect. If the patient needs to be seen in the ER, we do have special steps that they're going to take now. The patients are going to come in through the ambulance bay, make sure that they're putting on a mask first thing to help protect our staff and then also the patient as well. If this patient is someone that we suspect is a positive, they're going to go straight into one of our negative pressure rooms, which is going to be rooms 1, 5, or 6 at this point in time. And then all further screenings and stuff will be done in one of those negative pressure rooms. Our staff will be gowned and masked in appropriate PPE as well, which is the gown, mask, protective eyewear, and an N95 mask. Some of our staff does not fit the N95 respirator well, and so some of them will have on a Max Air helmet, which is just another form of a respirator to protect our staff. Currently, we cannot test in our lab for the coronavirus, and so if we have someone that we suspect is a positive, we are going to get in touch with Sandy Barber through County Health, and she is going to be in touch with KDHE as far as getting that testing handled in the appropriate manner.
So KDHE is the only one doing testing at this time?
Yes.
They're labs. We can pull the tests at the hospital and then we send it to
Right. The sample's sent to KDHE and Topeka.
Correct.
At some point in time, do you plan on being able to test here?
That's more of a question for KDHE. I feel like you might be able to answer that question better.
I would be surprised if KDHE contracted out for
Yeah.
testing. I really would be. Because it's too hard to keep the logistics going the right direction.
Yeah. And this changes every day.
Yeah.
We get new information today and then
Yeah.
might be sitting as tests too. It depends on how it progresses.
Thanks, Nicole.
All right. Thank you, Nicole.
Tabitha, do you have anything?
Just as county health, we did have our first ESF 8 meeting on February 7th, and so we have been planning, all of us as a group, on what to do since then, and we keep having meetings. I've been in touch with the schools. I meet with them again today. We're putting information out for the kids. As you probably all are aware, the schools are closed for the week, which we were on spring break anyway, but that was put into play last night that all state schools are closed for the week, and then we'll make a determination as things progress through this week what we'll do going forward.
Where can local people go to receive updated information? Is there a website or a source that they can seek?
Right now, we're directing all of our public information as a team through county health. They are doing press releases, and it is being shared on hospital website, hospital Facebook, emergency management Facebook, county health Facebook. So we are getting information.
You're getting it out best you can. Okay.
And keeping the schools. They've been sending out stuff through their information system, schoolware, whatever it's called now. I'm sorry.
Remind.
Yeah. So.
Yeah. Okay, thank you. Erica?
So from a clinic perspective, we are screening all patients before they come into the clinic. KDHE and CDC recommendations right now are that if a patient can manage their symptoms at home, that we do not bring them into our facilities. So we are doing telephone triage with any patients who have any sort of respiratory symptoms, especially the fever, cough, and shortness of breath, which are the three key ones that we've been seeing with the coronavirus. So all patients are screened before they come in. If they can manage their symptoms at home, we have a list of information that we can share with them on how to manage themselves and others in the home with them. If they do need to be seen in the clinic, then we will be in touch with KDHE first to see if we are able to test them. The idea is we do not want to bring them into the clinic to be seen and then have to bring them back in to be tested. So that would all be coordinated before we schedule an appointment. If it is a patient who does need seen ASAP because of their symptoms, we certainly would go ahead and get them in. But if it's a patient who can remain at home, then that is the plan. We have signs up right now to stop people from coming in if they have traveled. We actually are going to put some new signs up today that just says, stop if you have any respiratory symptoms, please call before you enter our facilities. So, but the main recommendation really is if the patient can stay at home and manage their symptoms, then they just need to stay at home.
Is there some type of a deal if they are at home that someone doesn't go into their room?
So the recommendation is that they self-quarantine. There are plans in place if we would ever have to mandate a quarantine. That would come through the county health officer, Dr. Lick. But at this point, it's really just the recommendation to self-quarantine, isolate yourself, and stay at home, unless we felt like it was a public necessity.
Okay. Thank you, Erica.
We haven't really changed anything for our protocol other than letting EMS or first responders know that there is an elevated risk so they know what to do.
Are your dispatcher, are they asking more questions?
Not more questions. I mean, we're asking the same questions. We're just relaying it a little differently.
Okay.
We've made some changes to our scheduling to try to eliminate the number of EMTs that we have that are going to be in contact with these potential patients. We've made those changes. We will be putting those into effect. We have a mandatory EMS meeting tonight, so we will be going through all of our procedures to the nth degree with everyone, because that's, I think, the best way to keep our people safe is for them to be following all of the
Sure.
things
Well,
that
that's what the guidelines are for.
Yeah.
Yeah.
So, you know, I think as long as on our side, if we're hammering those out, that we're doing the right thing going in to be that first form of contact, that I think if we're doing the right thing, we can at least eliminate the risk for everyone else too. And I think working as a whole.
And then I want to point out too, long-term care is included in this group usually. I mean, Tammy's been working with us. She did the first meeting, and I'm sure you've seen or heard that they've already.
Usually they've been the hardest hit around the country at nursing homes, so.
Well, they have our most vulnerable population.
Sure.
There, so.
Sure.
So they are in lockdown and they're screening people that come in and out. So.
Good. Well, it sounds like we're doing about as much as we can possibly do, right?
Well, the biggest takeaway is I just want everybody to be aware that we are working as a group. We're working very well. We do have plans and preparations in place should we need them. But right now, we're just, we're trying to mitigate the spread and do what we can to protect our people, so. But we are all working very well together, and the public can rest assured that we are on top of it.
Well, I personally am comforted by your efforts. I think everybody else should be too.
Any
All
other
right.
questions?
Well, I'm sure there'll be plenty, but
Well, just keep in mind, this is a very fluid situation, so
Sure.
it's changing daily, so we're
All
going
right.
to stay on top of it.
But I think it's comforting that you did come to the meeting so that it can get out there what is being coordinated, who is on the team, so that it can bring some calm to the people.
Yep, that's what we're hoping.
me too.
Thank you.
All right, thank you very much. I truly believe we have a really good team of people.
Oh, we are fortunate.
Oh, I
Like
agree.
you would not believe.
I agree.
Well, I blocked out a half hour for them because I didn't know how long they take. So.
Well, I guess we'll take another break till Eddie gets here.
Well, do you want to
Oh, yeah, let's
do
tackle
our
this thing.
piece?
Okay.
You just had to burst my bubble, didn't you?
What?
That we collected 140.
Well, but the thing of this is we will get 140 because on all of those, because when you look, you're billing insurance, Medicaid, Medicare. I mean, yeah, there are some billed patients here, but most of these amounts are coming from insurance.
Well, we're a lot better off right now than we were this time last year.
But, even if it's billed to the patient, they're
Yeah,
very
thank
good about working with people and setting up payment plans and such.
More of them?
Wow.
Great.
Morning, everybody.
Good morning, Eddie. Wow, that's a lot of property.
I take it this is the amount for the rebate?
Yeah.
Like in fact, that's what they paid, and that's what we rebate them.
I think that's correct. Because they have to be paid in full first.